Dear students, welcome to GAME, Gross and Microscopy Explained. I hope you identify the couple of pictures on the screen. It is a case of actinomycosis. The significance of this is given in the enclosure, and it covers a lot of subjects including pathology, surgery, microbiology, and so on. The clinical types can be divided as follows. The main ones are the cervicofacial, thoracic, and abdominal. In the female, the pelvis is another site that can be affected. It is caused by an organism called Actinomycosis estrelei. It was thought to be a filamentous fungus, but has been found out to be a gram-positive bacteria. Clinically, the patient can be presenting with discharge of sulfur granules, and there can be a sunburst appearance. In this picture, I am finding a few sinuses which have healed. These are the discharging sinuses, classical of actinomycosis. So, there is a lesion in which there is a tangled mass of hyphae, and towards the periphery, I am able to identify the individual hyphus. It is a beautiful sketch which you people can have in mind. Also look at this picture, a black and white in which I can see very delicate but entangled mass of filaments. And this will definitely be the slide for you students. There is a hematoscopy or a bluish entangled mass of filaments, and towards the periphery of it I am able to find a pink line. Still more in the periphery are the inflammatory cells, mainly neutrophils in this particular case. It is a normal common cell found in the oral cavity, but because of poor oral hygiene, periodontal disease, major surgeries, radiation, and immunosuppression, a patient can manifest actinomycosis. A superb picture retrieved, and in this I am finding tangled mass of hyphae. These are here, and towards the periphery I find that there are very fine delicate filaments. In this there is an artifact. An artifact is like this because it's a clear space that has been created because of processing or section cutting. So the importance is it can be a theory question, a slide in pathology, microbiology, surgery, and in real life actinomycosis can haunt us. A superb diagram over here. This is another tangled mass of fungal filaments. Towards the periphery, however, I am finding this Y-shaped structures which indicate the antibodies. It is diagrammatic and you people can have it in mind. The same thing is being replicated in this picture. Here it is a tangled mass of filaments. I am not able to find out the individual filaments, but towards the periphery there is a pinkish zone that is covering almost the entire one. This is supposed to be antigen antibody complex, and this is called the Splendor-Hopley phenomenon. Externally there are the inflammatory infiltrate. And this is again a very nice microphotograph. Tangled mass of filaments. Externally, I am able to see the antigen antibody complexes, which are eosinophilic, called as the Splendor-Hopley phenomenon. Sometimes we will be finding necrotizing granuloma. In fact, this is one of the differential diagnoses for granulomata. The treatment of choice is penicillin. A beautiful diagram by a student. I am finding the bluish filaments, then the covering zone of Splendor-Hopley phenomenon, namely the antigen antibody complex, inflammatory infiltrates. It is also a disease of the cattle in which I am finding multiple cystic lesions of the jaw, actinomycosis, lumpy jaw. This is supposed to be a clinical description for the disease. See you in game 40.